Welcome back to Part 3 of Cognitive Theory. With significant cognitive distortions, the client must identify the situations that triggers the misconceptions, determine how they can most efficiently adjust or replace with new thinking patterns, and then implement corrective tasks. One intervention used is called cognitive restructuring. This is used when a client's thinking patterns are distorted and contribute to problem development and persistence. The ABC model is the basis. A represents an activating event. B is the client's beliefs or interpretation of the event. And C is the emotional and behavioral consequences of B. An example of A is if A is an event, say a rainy day, and C, the consequence, is a person's feeling of depression, then B, the belief, might be, everything looks so dreary and ugly and I want it to go out. Nothing can go well for me today. If the same activating event, the rainy day, occurs but the resulting emotion is contentment, then client's beliefs may be, I can stay home and read today and enjoy this cozy day. The ABC process occurs so quickly, clients often think A directly causes C, but except in certain reflective actions, there is always a cognitive event that intervenes, which is B, the beliefs. 3 steps must be taken to change belief systems. First, you must help the person identify the thoughts preceding and accompanying the distressing emotions and non-productive action. Put the client into a frame of mind in which he or she can reflect on thoughts and feelings as if the event is happening. The second step is to assess the client willingness to consider alternative thoughts in response to the situation. One way is through point-counterpoint or the cost-benefit analysis, where the client lists costs and benefits of different thinking patterns. The third step is to challenge irrational beliefs by designing natural experiments that can be carried out in daily life to test validity. Cognitive intervention requires clients to fill out an ABC form over a specified period of time to help become more aware of automatic thoughts and work to modify. Another intervention is called cognitive coping. This is where the social worker can help the client learn and practice new or more effective ways of dealing with stress and negative moods. This is done in a step-by-step fashion to master these new skills. This includes education and skills development with the goal of becoming more effective at managing challenges. Some examples of this are self-instruction skills development and communication skills development. Another intervention commonly used is problem-solving skills development. This is a 5-step method for those who don't experience distortions but struggle with problems they clearly perceive. The first step is defining the problem to know what they want to specifically work on. The next step is to brainstorm and generate possible solutions. The third step is evaluating alternatives and discuss the advantages and disadvantages of each possible solution. The fourth is to choosing and implementing an alternative, and the fifth step is evaluating the implemented option. You can also then generalize this problem solving to other situations that the client may face. Role-playing is also a strategy that is often used. The social worker models the skills, and then the social worker and the client rehearse it. Cognitive therapy is also often used with behavior therapy and to combine into cognitive behavior therapy, which is taught in many different social work programs. These are some ways that cognitive theory is used in assessments and intervention in social work. Now Kylie will tell us about spirituality and social justice and the effectiveness and criticisms in cognitive theory.
Thank you, Samantha. Now that we've covered some of the foundational basics of cognitive theory and the process of cognitive theory-based interventions, I'm going to talk a little bit about the connection between cognitive theory and spirituality. Within the context of cognitive theory, spirituality can be understood as the core beliefs and values that provide us with meaning and motivate our actions. The concepts of cognitive theory can facilitate an understanding of client spirituality and promote reflections on the topic, as opposed to some theories such as behavior therapy. Interventions based on cognitive theory help clients reflect on long-term goals and the significance of problem situations within that context. By encouraging clients to reconsider ways of understanding and act on challenges, such interventions are relevant to the client's spirituality. Our core values and beliefs are related to our spirituality and/or religion. It is impossible to utilize cognitive theory techniques without addressing spirituality. Cognitive theory might reinforce spiritual beliefs, but it might also cause people to question their values and beliefs. Cognitive theory is grounded in social justice values. I'm going to discuss some of the concepts and approaches that make this true. First of all, I'm going to discuss the empowerment approach. Cognitive theory focuses on empowerment of clients, and empowerment is one of the values of the social work profession. People are empowered to become competent problem solvers and can be helped to generalize problem-solving strategies to other life challenges when working with cognitive-based interventions. Another way that cognitive theory promotes social justice is by encouraging sensitivity to diversity. The concept of the social construction of reality underscores the social worker's obligation to be sensitive to issues of cultural and ethnic diversity. The theory can be applicable for all client populations, anyone who has the capacity for cognition and reflection. Therefore, race, ethnicity, culture, gender, socioeconomic status, sexual orientation, none of that matters because the theory can be applied for anyone, regardless of these things. Cognitive theory may also be especially appealing to people of lower socioeconomic groups, Latinos and African Americans, because of its concrete, practical approach to problem solving, which is preferred by these groups typically. However, despite these social justice components related to cognitive theory, the focus within the theory is on the individual and microenvironment rather than the macroenvironment. The social worker is not encouraged to look outside the client except to consider environmental evidence for his or her beliefs about the problem. Cognitive theory has been shown to be effective in several ways. One of the strengths of the theory is that its interventions lend themselves to empirical research methods. Cognitive theory interventions meet the criteria for the American Psychological Association classification of well-established interventions for the following: geriatric depression, major depression, anorexia, bulimia, and conduct disorder. This list becomes even longer if cognitive behavioral interventions are included. Well-established interventions for cognitive behavioral include agoraphobia, panic disorder, generalized anxiety disorder, post-traumatic stress disorder, social anxiety, chemical abuse and dependence, binge eating disorder, smoking cessation, avoidant personality disorder, schizophrenia, ADHD, and childhood anxiety. According to the APA classification of probably efficacious, one of those interventions is obsessive-compulsive disorder interventions, and probably efficacious cognitive behavioral interventions are for opiate dependence, irritable bowel syndrome, sickle cell disease pain, marital discord, geriatric caregiver distress, sleep disorders, and disorders of childhood and adolescence. A literature review by Butler and Beck showed that cognitive therapy was substantially superior to lack of treatment, waiting list, and placebo controls for adult and adolescent depression, generalized anxiety disorder, panic disorder, social phobia, and childhood depressive and anxiety disorders. A number of meta-analyses and literature reviews over the past decade show further evidence for the effectiveness of cognitive behavioral interventions for various social functioning problems. In our next clip, we will discuss some of the main criticisms of cognitive theory, check back in with our friend Fred, and provide a brief overview of what we've discussed.